Sorry about that. Okay.
With the mics
In the Microsoft.
chairs, in
Actually,
case I don't want to have someone who's using a wheelchair to take
just have to tell them to hold it.
I may have already done that. Okay. So just maybe consider that, just a guess. I don't know actually who, if any are coming, but just make it easy right away. Perfect. That's great. Well, take it off this. Okay, yeah, so we're, when the heads are on, we're already over, so. Okay. Okay, everything's all set up. Thank you.
You
And.
just have to turn on the microphone. That's pretty much it.
Okay.
What do you need?
We're not. Computers.
Well, I'm used to that at this point.
Meg, do you want to use your computer for talking points or?
Whatever. You guys need.
Sure. And get mine out. Oh, okay, well, good. That's perfect.
Thank you so much.
Right, we're good. Solid.
Yeah.
So you wouldn't mind. Three of us. Okay. I've got a couple of kids on the same time. Where you leave? Okay, all right, will do. Thank you. Okay. So I like.
Yeah, okay, all right, I'll see you.
Good morning.
Yes.
Okay.
Good morning, everyone. Thanks for joining us. I usually miss microphone, but when we close the door, let me know if I don't need it. I can project my voice, but just in case, I'll start with it. Welcome. I hope you guys had a nice morning. Got your coffee, got your first session, and thank you for coming to this session. This is accessing home and community-based services. I am Karli Altman. I work at the Department of Healthcare Policy and Financing. And I have here with me today Meg and Kidron. Together, we've got probably over 30 years of experience in the long-term services and supports world of Medicaid and HCBS services. So we're really excited to be here today with you and give you a high-level overview of what HCBS is, what long-term services and supports are, how you're going to access those services and supports, get in touch with the right agencies to start that process. And then we'll be able to have a little bit of time towards the end of the session that we're going to focus on some of the residential supports that are offered through those programs. And we'll leave plenty of time at the end for questions. So keep those questions in mind as we're going through. It is a lot of information. It can be a little bit overwhelming to hear all of the different pieces of information and components of how you're going to access and use these services. But again, we'll have plenty of time at the end for you to ask specific questions that you might have, or if we need to flip back over to a slide and make sure that you get your questions answered. If we don't have time today, because I know we're running a little behind schedule, we will be here this afternoon as well. There's another session. We'll have plenty of time for you guys to access us and ask questions. So before we jump in though, I want to do a quick poll of who we've got in the room, just so I can make sure I'm giving you guys the right level and type of information. Can you raise your hand if you know what long-term services and supports are? Okay, we've got a couple. I see some in the back. Can you raise your hand if you know what home and community-based services are? Ooh, more. Okay. Can you raise your hand if you know the term waiver? Ah, okay. Do you guys all feel like you know what a waiver means? Why we call it a waiver?
No.
Okay. So we're going to get into a little bit about that, but we're going to go and talk about accessing waivers. When I say waiver, HCBS, home and community-based services, when I say long-term services and supports, we're thinking of all of those things under the same umbrella, okay? And a waiver is one program that's under that umbrella. We've got 10 different waivers in Colorado. And we're not going to go deep into the weeds on all of those waivered programs, but I'm going to start off by telling you a little bit about just Medicaid in general, overview of those long-term services and supports, and our case management agencies. They play a really pivotal role in getting people access to those programs and services, along with some of the financial eligibility requirements. Again, not going to go too deep today into all the nitty-gritty dollars, but we do want you to know there are requirements that people have to meet in order to access the services at a financial level. And then we'll go and talk, show you slides on the individual waivers and highlight those residential components of the waivers that are available. And I'm going to turn it over then to Meg, and she's going to go a little bit deeper into what those services are, because after all, we are at a housing summit and you're interested in housing, right? So long-term services and supports, what are they? We can access long-term services and supports in a variety of settings. One is home, right? Home and community-based. Community, that's the second part. And then within facilities, this is the facility part, is where we're talking about nursing facilities, intermediate care facilities for people with IID. And the home and community part is where we're talking about waivers, that HCBS part. Waivers are called such because they are the federal government allowing us to waive our requirement to provide care in an institutional setting. They're also allowing us to waive certain financial requirements and kind of up that threshold of what somebody needs to make in order to qualify for a waiver. So that is why they're called waivers, and it can be kind of confusing. What does a waiver mean? But that's really where that comes from. When the federal government provides us funding, us being the state of Colorado, they say you have to provide care at the state plan level. That's non-negotiable. You have to do this. The federal government says you have to provide Medicaid. So that's where you're going to see things like hospital services, primary care doctor services, medication services. And then they say you have to provide long-term care too, nursing facility, intermediate care facility with IID. Case is one of those things. Case management is one of those things. Then they say, you know what, if you want to, you can provide waivers, and we'll allow you to provide care that would otherwise be provided in an institutional setting, a hospital or a nursing facility perhaps. You can provide that level of care in the community. You can provide it in the person's home, you can provide it at a day center, you can give them that same level of care without having to reside in an institutional setting. We'll give you a waiver to be able to do that. So today we're talking about HCBS waivers at the top of the pyramid. If you're somebody who gets eligible for an HCBS waiver at the top of that pyramid, you get access to all of the types of care that are below that. So you'll get access to state plan benefits, the primary care doctor, the prescriptions, all of the things that Medicaid will cover. So how do you get eligible for the top of that pyramid? It can be a little bit complicated, but I'm going to try my best to break it down for you into a couple different sections, okay? There's financial criteria. This criteria is managed by the Department of Health and Human Services in your area. So your county, local county level, DHS, Department of Human Services, is going to be the person or entity that establishes financial criteria. They're going to be where you need to go to give them your bank statements, your financial statements, for them to look it over and say, yes, this person makes enough money or doesn't, or makes too much money to be able to qualify for these public service programs. They're also going to ask you and funnel through them the disability application, Social Security Administration's disability application. You need to have that to be able to access the waivers. There's some other information for each individual waivers called targeting criteria, and that we'll talk about that a little bit later. But that's a different component of disability determination, okay? So we've got two different kinds of disability determination. The third component of HCBS eligibility is where your case management agency comes into play. And they're going to be the one that does your level of care assessment. That's an assessment to say, hey, can you tell me a little bit about how you operate in your daily life? What kind of supports and services do you need when you're doing bathing and dressing and mobility and getting around, right? And they'll go through that assessment to determine whether or not you meet something called the level of care. Now, remember when I told you about the waiver and how it's an alternative to institutional placement? What that case manager is looking for is to make sure that you meet a level of care for somebody who would otherwise have to be served in one of those institutional settings, meaning you need a really high level of care and a lot of supports in order to be able to access these programs. Instead of accessing care in an institution, you're going to access it at home, okay? So they'll do that assessment and they'll also assess for targeting criteria. Targeting criteria is what's specific to each of the individual waivers. Oh, I did just tell you. Just kidding. Level of care, sorry. We've got 3 different levels of cares right now. They're all done through that same assessment. Again, it's determining whether or not you need care in either the same level as somebody that would be receiving care in a hospital, a nursing facility, or an intermediate care facility. Then targeting criteria, I have an example on here of the developmental disabilities waiver and what that targeting criteria means. But in general, the targeting criteria for each one of the 10 waivers includes things like looking at somebody's age. We have different age ranges for the different waivers that we provide. Looking at some of their diagnostic information. So depending on the waiver, there may be a very specific diagnosis that you need in order to access it. Injuries or other ailments, and then the region that you live in. Some of our programs are only eligible to certain regions in the state, like PACE, although we're working to expand that. But for the DD waiver, you can see the targeting criteria. You have to be over 18 to access that waiver. You also have to have a developmental disability determination, which is that targeting criteria we talked about that's separate from this Social Security disability determination, okay? And then you also need to require access to receive supports 24 hours a day in the community. So again, this waiver, high level of need for somebody who wants to access this waiver. It does have a waiting list too, and we'll talk about that in a little bit. This is the information on developmental disability determinations. And again, this one I chose to put on here just because we do have an IDD focused here today. And it's really important to understand that not all of our waivers are for people that have intellectual and developmental disabilities. Some of them are geared towards other populations, but the 2 adult waivers that we have that are specifically for that population do require a developmental disability determination. And that determination is going to require things like IQ testing or adaptive and behavior testing. It's going to require other documentation to prove that any sort of diagnostic information occurred during those developmental years prior to the age of 22. And your case management agency is going to be the one that is looking over that information and then making the determination based on Colorado's rules, whether or not you would qualify. That's only one step, right? You still have to do that level of care assessment as well. You still have to do your financial assessment. And then you might even have to do another assessment called the supports intensity scale. So we've got a lot of assessments going on here, but that's because we want to make sure that we're really gathering the information that's necessary to get the supports that are needed for that person. So who makes all of that assessment action happen? Case management agencies are one of them. They are going to do intake and referral. They're going to answer your phone calls to say, hey, I'm interested in this waiver. What are my next steps? What do I need to do? They're going to be the ones that come and set up an appointment with you to have an assessment completed. After the assessment is completed and your eligibility is determined, so we've got financial, functional assessment done, your developmental disability determination done, then they're going to be the ones that are doing service planning with you, which means authorizing those services that you get to access at the house and the community outside of those institutional settings. After they do service planning, get your services set up and started, they're going to monitor those services and they're going to do an assessment every year after that. So you don't just get assessed, get eligible, get in, and never have to talk to your case manager again. You're going to have to talk to them multiple times a year because they're monitoring to make sure that those services that are being authorized are actually being provided. And they're also going to make sure that you're doing all right, that you're getting the services you need. Maybe they need to make a change in your service plan, add more services, take services away that you don't want anymore, don't use anymore. And then annually, they'll do that assessment to make sure, hey, we're still eligible and ready to go. You're going to have to do the financial assessment every year too. This slide is about case management redesign, which is something you guys probably have heard about over the last couple of years. And there is another session after this one about more in detail on case management redesign. I just wanted to share this with you guys to let you know that our system has gone through a pretty big change over the last year. So we have taken our case management agencies and gone from 45 different agencies across the state down to 15 that serve 20 different direct service areas. So that was a huge, huge change. You know what didn't change? The number of people that need services. It didn't change the number, our size of our state didn't change, right? So we still have the same number of people, if not more people every year that are coming and needing services through Medicaid. But we're very confident in our new structure and that we are making an environment for people to be able to access the services and supports they need through one door in their area. So not just IDD services, not just elderly services, children's services. You can go to your case management agency and they should be able to get you to the right services at the right time. This is a map I like to show that shows the case management agencies. It's actually an interactive map on our website and you'll be able to link to it. This presentation will be available to you, but it's a very fun map to use when you're trying to find out who's in my case management agency. How do I know who to go to? Because there's 15 of them, right? You want to make sure you get to the right one. All right, so case management, they're doing that functional eligibility. Then I talked about financial eligibility. There's some requirements for financial eligibility. And again, your Department of Human Services is going to do that. But these are a couple of the things that they might ask for when they're making that determination to see if you're eligible for Medicaid services. They're gonna look at your identity and your citizenship, so they're gonna want to confirm who you are. Whether or not you've got that social security disability determination. Did SSA say that you've got that disability or not? They'll be looking at income and they'll be looking at resources, and they're also looking for that level of care that the case management agency is gonna do. Now, there's a couple different ways to get in touch with the Department of Human Services and start this application process. The way that I recommend people to do it to start with is by going to a website called Peak. And Peak is a patient portal, customer portal, where you can go and start your application to see whether or not you're financially eligible, not just for Medicaid, but Medicaid is on there. You can also see if you're eligible for programs like SNAP and other public assistance through that portal. You can also just go down to your county office and say, hey, I'm here and I want to apply. They have paper applications there. They've got people there that are able to help you, and you can call too. So there's a lot of different ways you can get in touch with them. If you get your hands on that paper application, which is also on our website, you can fax it over to them. You can submit it. You can call your case management agency and say, hey, can you help me out? I need to get this over to the county. Okay. Here's some more income limitations and things that the county is going to look at. Primarily, the long-term care applicants' gross income must be under 300% of SSI. So remember when I said that we waive certain things, the federal government's letting us waive things to have these waivers. One of them is this income limit. You can be 300% of the SSI income limit, which is 2,829 for 2024. This is a little bit higher than the income limits you would see for somebody just wanting to access straight state plan, Health First, Colorado Medicaid, right? And the reason for that is we're saying, hey, you can have a higher income as long as you meet that level of care. We're going to allow you to access this waiver program, which then, remember, if you're in the green triangle at the top, gives you access to everything below. So that's one of the benefits of a waiver. You can probably have a little bit higher income than you would if you're just getting regular Medicaid. There's resource and asset limits for these programs, the same way there are for regular Medicaid. 2,000 for a single person, 3,000 for couples that are both applying. I don't want you to get too caught up in the numbers on these screens and the limits on these screens, because we also have other ways for people to access waivered programs. Excuse me. If your income or assets is a little bit over than that, we have something called the buy-in program. And that basically allows you to buy in to Medicaid, meaning you pay a little bit of a premium and you get to access the same types of Medicaid services that we talked about before, and sometimes a waiver if you meet all of those other requirements. There's also ABLE accounts, which I'm sure you guys are familiar with too, but I just put these up here to make sure you understand that don't let the dollar amounts be a deterrent to applying for a waiver. It doesn't hurt to apply. The financial eligibility folks at the Department of Human Services, they're going to go through the process to say, what does this person qualify? Can we offer them buy-in if they're over the amount of a few dollars? And be able to try and find the best path forward to you. So again, it doesn't hurt to apply or tell somebody to apply that you know that might need the services, especially if you think that they were meeting that level of care, that really high need. So 3 main aspects to accessing that we just talked about. You're going to contact your local case management agency. You can use that map to find them. You're also going to think about which waiver might best suit your needs. And we'll talk about the waivers here in a minute and which types of services are offered on those waivers or the population that they serve. And then you're also going to go to Peak or your local county DHS office and start that financial application. Now, with all of that information, how long does this take? Whew, it's not an overnight process, guys. These programs are not made to be emergency services. They're really not. They're meant to be long-term services, meaning you're going to access them long-term. And part of the reason that we're doing the assessments and we're asking for all of the information to apply is so we can make sure we get it right and we're serving the people that need these services on a long-term basis. So when you go through this process, understand that there are a lot of steps and it may take a little bit of time. Your case management agency has 2, 5, or 10 days to do an assessment after they get a referral for you, if you don't need a developmental disability determination. So those IDD waivers, timeline's a little bit different because that extra determination can take a longer time, 90 days. Then your county has 45 days to process your financial application. 45 days when they have all of the appropriate information that they need. So if you don't submit a bank statement until day 44, that doesn't mean that they have 1 day. That means they've got 46 days after that, okay? If you need the Social Security disability determination, that gives them another 45 days. So in total, we're looking at a 90-day, 3-month period, and that's if everything goes according to plan, okay? And I don't tell you that, again, to deter you from applying. What I want to do is set the expectations that this can be a long process, and there's very important information that each of the entity needs for you to be able to provide to them to continue the process moving forward. If you're outside of these timelines, then reach out to your case management agency, reach out to your county and say, hey, I think I'm outside of these timelines. What's going on? What are you missing? Right? Where are we at? Some additional considerations. I talked a little bit about this. The sports intensity scale is another assessment that may be needed depending on the waiver you're applying for. So that can add extra time. Okay. If you need to do SSI, again, extra time. There's links on here that you'll be able to click when you get the presentation to see those additional resources and the information. So what happens if you go through all of that and you've done all the assessments and you've submitted all the applications, and somewhere along the line, either the case management agency or the county says, sorry, you don't qualify? Well, there are some other options because that does happen. Not everybody qualifies for these programs. You have appeal rights. You have appeal rights from your case management agency or your county, and you can always appeal any decision that's made and go through that appeal process, whether it's for the county or the case management agency. If you get a denial and you think, no, they're probably right. I make too much money, or I don't have high enough needs, or this program's not right for me. There might be other programs that you are eligible for that don't require the same level of intensity of application process. You could potentially access the state general fund programs. Those are also managed by your case management agency, but they don't require a level of care assessment be done. They manage their funds locally, so they have a little bit more flexibility with those programs. You could also go to your regional accountable entity. They manage behavioral and physical health needs. And if you're just eligible for Medicaid, but not meeting that level of care, your regional accountable entity might be able to help you get connected with some specialized services. There's also local IDD funding, that some people call mill levy funding. Not every case management agency or county has mill levy funding, so you have to go to yours and figure out whether or not you've got access to that funding. And then obviously local ARC and advocacy groups can also help. So a couple takeaways from today. That was a lot of information, but we do have a new webpage called Learn About LTSS. It has videos on it that are meant for members, community, family members to learn about LTSS. There's some animated videos. There's also videos that are real people with some sign language interpretation. They are in English and in Spanish. So we're really trying to make sure that you guys have the resources you need to learn about these programs. There's brochures for all 10 of our waivers and our state general fund programs, both in English and Spanish. So I encourage you to go to that page and access those resources if you're wanting to educate other people about these programs and be able to learn more. All right. Waivers, what we're all here for. These are the 10 waivers in Colorado that we have right now. We've got 6 adult waivers and 4 children's waivers. The waivers that are designed for folks that have that developmental disability determination and the IDD population are the developmental disabilities waiver, the supported living services waiver, and the children's habilitation residential program waiver, and the children's extensive support services waiver. So we have 4 waivers in the state that specifically serve people with an IDD. You'll need to have that developmental disability determination completed, with those IQ tests or adaptive behavior tests, plus the documentation of it occurring before age 22, in order to access those waivers. The DD waiver does have a waiting list. I said that earlier. That waiver is designed for folks who need access to 24-hour supports and services in a residential type setting. So if you don't need that level of care, that's not the waiver for you. It might be more appropriate to access the supported living services waiver, or even the elderly blind disabled waiver, the Colorado community mental health supports waiver, brain injury waiver, spinal cord injury waiver. Because sometimes you can be eligible for more than one waiver at once. You can only enroll into one at a time. You only get to pick one, but you may have co-occurring things going on that allow you to be eligible for 4 of these waivers at the same time. And then it's up to you to be able to choose which waiver is best going to meet your needs. Knowing that the DD waiver has a waiting list, you may choose to access a different waiver while you're on the waiting list, and that's okay. This is another resource that you'll be able to access. These are our waiver charts. It gives you a side-by-side comparison of each one of our waivers. And it tells you the age range that they serve, the services that are available throughout those programs. So you can really look and compare which one do I think might best meet my needs. Thank you. So then I'm going to scroll through the adult waivers before I hand it over to Meg. And what I've done, I'm not going to read the whole slide to you because you'll get bored, but on each one of these slides, it gives you a little bit of information, that targeting criteria that we talked about, so the age and diagnostic information. And then on the other side, it tells you the services that are available in that waiver. So for example, brain injury waiver, this is a unique one because we call it an adult waiver, but you can actually access the brain injury waiver when you turn 16. So at that age, at 16, you may be eligible for the brain injury waiver because you did have some sort of brain injury, but you may also, again, have co-occurring things that might make you eligible for one of the other children's waivers. And then 2 years later, you might be eligible for one of the adult waivers, depending on what you have going on and what your needs are. Services that are offered in the brain injury waiver, what I've done is highlighted in yellow on these slides, which is the residential type of component for each one of the adult waivers. So in the brain injury waiver, it's the supported living program. Okay, I'm not going to go into those megas, but just so you know, when you're looking at the slide, that's the residential component. Don't get hung up on the fact that you're only going to see one highlight on the slides, because there's a lot of other services that are available in these waivers. And sometimes it's really important actually to access those other services so that you can help yourself or the individual you're working with prevent the need to maybe have a housing option. They can stay where they're already at. They might need to be able to access a home modification, and just accessing that home modification benefit could allow them to stay where they're at for longer, and with the other supports that they need. Community and mental health supports waiver, just kidding, there's 2 highlights on this page. You get alternative care facility as a benefit, and you also get mental health transition living homes as a benefit. But again, look at all of the other services that are available under this waiver that you can access when you're not accessing the residential component. If you're in an alternative care facility under the CMHS waiver, you're not accessing these other services, all of these other services, because that would be duplicative, right? The alternative care facility that you're in is responsible for providing a level of support and care to you, that you won't be able to access every single one of these services that are on here that the alternative care facility is responsible for providing. Developmental disabilities waiver. This one is the residential rehabilitation services. That's 24-hour individual or group support. When you're in the developmental disabilities waiver, you have to be 18. You have to need that 24-hour care. Again, has that waiting list, but quite a few services available there too. again, we don't want to duplicate services. So any services that your residential provider is responsible for providing to you, you don't get to access outside of them. Elderly, blind, disabled, this is probably one of the most popular waivers. It's one of the waivers that serves the largest number of people. And alternative care facilities are here too, right? But look at all the other services. We have CDOS, IHSS, those are consumer directed attendant support services and in-home support services. Those are participant directed programs that allow you to manage your own attendance and go through that hiring process. You can also do IHSS, which has an agency backing to it if you don't want to get into all of the financial component of everything. Sometimes going that route is a lot more appealing to people that don't want to have to go into the residential component because there's a lot of rules and regulations for those residential components, and Meg will talk a little bit about that. Supported living services, no residential component, no highlight, sorry guys, but it does offer all of these other services, right? Rehabilitation, homemaker, life skills training, peer mentorship, personal care. This sometimes is the best option for people. Complementary integrative health waiver. This one used to be called the spinal cord injury waiver. So that's something you might have heard, and it's been renamed recently to complementary integrative health. It offers some new services, acupuncture, chiropractic, and massage. But again, no highlight. So you're not going to see that. But if you're somebody that has these types of diagnostic things going on and needs this type of waiver or wants these types of services like chiropractic and massage, that might be more important to you than some of the other services or waivers that have the residential component because you want to access these services. That's okay. I put a home mod slide up on here just so that you guys are aware that home modifications are available in almost all of our waivers. You see the list of them down there at the bottom. We're not, the children's extensive support waivers on there. They have a little bit of different criteria, but I just put this up here and I know the text is small. Sorry about that. Just as a reminder that of something I said earlier, where maybe it's more important to access a home modification benefit and get your home altered and more accessible than it would be to try and find a different residential place to go, whether that's an assisted care facility. Say going into the DD waiver and going into a group or host home, or staying in your own home, you're not going to be eligible for that home modification benefit. So you might need to access to a different waiver. With that, as I spoke so quickly, I'm going to pass it to Meg and let her introduce herself, and she's going to go a little bit more into the individual services. And then we'll try to leave about 10 minutes at the end, 5 to 10 minutes to answer questions.
I will sure try.
We're fast to start a little late.
Well, I appreciate it.
Here you go.
Thank you. I'm gonna notes up here. Hi, everyone. My name is Meg. I work for CHFA as well, and I oversee specifically the residential benefits in addition to other benefits as well. So residential, I'm sorry, this is probably better. Residential settings. Services in residential settings can be done in a variety of different ways. Specifically with intellectual and developmental disabilities, a lot of what we see here is host homes, independent living arrangements such as independent apartments, group homes, and family homes, as well as some larger supported living facilities. So I'll briefly go through some of those options. Okay. Alternative care facilities. So this unfortunately is not available within the developmental disability waiver. This is available within the brain injury waiver and the EBD waivers, elderly, blind, and disabled. Alternative care facilities, also referred to as alternative living facilities, offer a variety of different things. Since it is an 24-hour oversight, medication administration, personal care, and homemaker services. Now, it is important to remember that members that are residing within alternative care facilities are also required to have something called a post-eligibility treatment of income, or a PETI. And what this is it's kind of a worksheet a math worksheet that basically says, this is what your income is. This is what some of your financial responsibilities are, such as spousal support, child support. Maybe you have recurring tax payments that you have to make for that year. And it spits out a number that basically says, this is your cost of the services provided. So there is, in addition to what the waiver pays for, there is a member cost towards those services as well. Now we have the supported living program. So the supported living program, this is available within the BI waiver. However, one of the other things that was on that big breakdown of services was also something called the transitional living program. They're very, very similar. The biggest thing between a supported living program and a transitional living program is a transitional living program is meant to be temporary and pretty close to after a brain injury occurs. Supported living programs are for individuals that are seeking long-term care, long levels of support within this facility. It includes the oversight, the medication management, those kind of things, but they can also include things such as adult daycare, some of those types of activities. The supported living programs also require a PETI, so that goes into that financial eligibility aspect. And what I think we're all here for is group and individual residential support services in the DD waiver. This is kind of my bread and butter. My experience is in IDD populations and those services. So this is the one that I am most familiar with. So the most common typically is host homes and family caregiver situations. There are also group homes. They are fewer and far between. They're not as popular of an option anymore. And then there are independent living situations. So the opportunity for a member to live in their own apartment, to live independently and have periodic support come in with access to that 24-hour oversight. Now, with these settings, they are kind of referred to within regulations under two different groupings. The IRSS, which is Individual Residential Services and Supports, and GRSS, Group Residential Services and Supports. The big difference between that is how many people are residing within this home. Under the Individual Residential Services and Supports, that's up to 3 people. So that's where you're going to see the family caregivers and the host homes. When you get to the group homes, that's the group residential, and that can be 4 to 8 people. Now, group homes obviously have a lot more regulations, a lot more that they have to do with the physical setting to be in compliance, to make sure that the members living in the facility or in the home are being served properly within Colorado. Family caregiver and host home, again, does fall under the Individual Residential Services and Supports. Now, with any of these services, any of the waivers, there's also a part of regulation that came out within the last decade called final settings. And final settings really does go into member choice, member rights, and more of a person-centered approach to these services. So the reason I bring this up is because with all of these waivers and with these residential settings, they have to comply with final settings. Thank you for that reminder. So some of the things that fall into that with a residential setting is that a member must have a lock and a key to their room. Sometimes that's not something that's automatically in a family home, but those are things that will have to be in compliance with a family caregiver. So let's see here. Before I move on to the next slide, I want to stop here and see, does anybody have any very, very specific questions to what would fall under an individual residential services and support setting or a group residential service and support? Yes.
So that means like the amount of people you're referencing, those are people that are accepting the waiver services.
Exactly.
Right.
Exactly.
Okay.
Yes. So these are Medicaid waiver individuals. Any other questions? Go ahead.
Can you just set up an apartment and then just rent it to your family member?
Yes, you can. There does have to be a residential component to it though. So that's where you have to become affiliated with a residential agency to be able to provide that support. Even if you are a family caregiver under the family caregiver model, you do need to be affiliated with a residential agency in order to be paid from Medicaid, but also to make sure that the appropriate oversight and all of the things that a residential agency or a provider agency is responsible for, as far as the regulations and their responsibilities to case management, to the state, all of that are still being followed. Any other questions before I move on? Go ahead.
Do you, settings, do you have to own the home? Like, could you have a setting where you have like a young person, so yeah, like you have young people who are renting an apartment and living together, like somebody who is neurotypical and a person with a disability, as like a mentor and a support, or would that not qualify?
You do not need to own the home. Renting it is absolutely acceptable, and especially in Colorado with prices as they are, renting is a lot better in a lot of ways.
So in that case, would you be like a host home provider?
Yes,
Okay.
yes. Unless you are a family member that is related to them, you could go through the family caregiver model in that sense. But in a lot of ways, that would be more applicable to a host home setting. That is part of the final studies rule. Yes, so they do need to have access to the setting as a whole, whether it's an apartment, whether it's a house or whatever. And then they also have to have a lock and key to their bedroom to offer privacy to themselves. Did that answer your question or? Yes. So if you have remodeled your basement and making it kind of like a mother-in-law suite, yes, they do need to have access to it if they are living independently. Yes.
That like, if it's not a walkout base, then that's fine.
Yeah, I think I see what you're saying. So you have to put a lock and key on the door going to the basement and only they can access it? Or is it a separate bedroom in the basement?
No,
I think wherever the door that goes into their actual sleeping area is what needs to have the lock.
Exactly. Exactly. Yes. So it doesn't necessarily need to have an exterior entrance, but they do need to be able to lock their belongings and be able to have privacy and security as they wish.
Have you?
My son has no skills whatsoever to operate a key or a fob or any of that. We actually are just kind of operate this his own home. And that was brought up, but nobody really gave us a significant answer to the question about the lock.
Yeah, so what we would want to do, so the final settings rule would require you to have that outlined in the residential agreement of how that member still has autonomy and control over their personal space. Again, final settings rule is really about making sure that all home and community-based waiver members have their rights protected in that residential environment. And so thinking about their rights, how do even people that don't have the physical ability to turn a key or hold a key, how do they still have that autonomy and control of how they're going to communicate? And that can be done in the residential agreement and in the member service plan that's created by the case management or the residential agency. Yeah, good question.
Thank you, Kidron. So I am going to move on from here. As Karli said, we will be available, we will be around, and we have an afternoon session as well if you have more questions. But we have 5 minutes left. So moving on from group and individual residential support situations, we have the mental health transitional living homes. This is specifically for the community mental health waiver. And I do need to make you aware that the purpose of this is a brand new service, really implemented within this last year. It's fantastic. It's wonderful. We love it. The purpose of this service is to offer a step-down residential placement from those larger mental health institutions of Fort Logan and Pueblo. This is accessible, if absolutely needed, to other members in the community. However, it is prioritized for members that are coming out of those institutions to provide a step down from that institutional setting so that they can step down and become more prepared for community living. All right. I guess I'm at questions now. Wonderful. Were there any other questions specifically regarding the IDD services in the back? Yes.
So, what is the general timeline of application turnaround?
Oh, goodness.
No,
For,
Are,
IRSS.
okay, so at what point are we starting? Are we starting from the very beginning of I have not been on a waiver at all?
Yeah, so we have waiver, for AMT. I thought we were like already classified as positive, because when I look at the website, I think plus website, our company is there. Yeah, so, but they told us that, to apply as a new entity when we submit that.
Okay, so you're a provider agency looking to provide IRS
Yes.
services, okay. And you have been in contact with, the Department of Public Health and Environment, CDPHE?
I,
Okay. So I think that's gonna be a lot more, individual specific, during the break. I'll grab your information and then we can communicate and I can look into kind of where you're at in that process. Yeah. Yes, go ahead.
Can I ask a Medicaid question?
I will do my best and I have some excellent colleagues here with me. Yes.
So I've, it was in the process of applying for Medicaid because my case manager suggested that it's in the middle of the chaos of the case manager redesign, and I am a client of AIM Avenues. So she said, go ahead and download the Medicaid application, but I can't write well enough. And my husband doesn't really, we don't understand it. So what I need is I need one-on-one support for somebody to explain from A to Z what it all entails, like you just did, what it all entails, but I need time to sit with somebody and say, hey, can you help me fill this out? And then can you explain what I need to do? Because I also have a full 40-hour a week job.
Absolutely. Ladies, who do you think would be the best person to be able to sit down and go through that?
yeah, so there's something called benefits counseling, and you can get set up with somebody that can take on that role to sit down directly with you. Your case management agency should be able to refer you to the benefits counseling folks, but you can also go onto a website called DB 101, Disability Benefits 101. And it's designed just for Colorado. They're a national organization, but they have a specific site that they built just for Colorado that takes you through sort of exploring what your benefit options might be. So you can put in different numbers for your income and resources and things like that, and it'll explain to you what options you might have. They also have the ability to connect you with somebody like that can sit down with you and say, let's get this application filled out. Alternatively, you can go directly to your county and say, hey, DHS County, I need that individual support. And it is their role and responsibility as the county entity that does financial eligibility determination to provide you that support if you ask for
Thank you.
it. Mhm.
Okay, so we are out of time here. As Karli had mentioned earlier, this will be available to you, this whole slideshow and presentation, if you should want it. And that also includes resources, contact information, and everything that we've discussed today. So if you have any further questions, feel free to find us during the break. Otherwise, have a wonderful day. Thank you.
How do we get the
Thank you. So I believe that, Tim Dolan will be sending them out. Yeah.
Thank you. Yeah.
Thank you.
Thank you.
Oh, Steven. Oh, I saw his pictures from the Broncos party. I'm like, he's having a great time.
I'm glad you found it useful. I was people that are in like Center for Independent Living, like, you guys know a lot already, so you're kind of like, you know, other stuff. And the slide, it's too much, but this slide deck that you'll get, the resource pages at the bottom, and I'm listening to it, are really good resources.
I want to get these applicants. I need help. Somebody help me with my mail, my family, and I need navigation. And I always surveys. On that, we will go from other stations, on other bases, because there's nothing real that says. Support with mail.
So, for with mail, support like when I come through from.
Yeah.
Like enough to have, that could all be done under. Waivers, the main, so. My elderly, independent, training. There's some other organizations too that when it comes, that might not be able to just. We talked about waivers, that personal care. They have to find that.